Okay, so my name is Wada. So I'm the person in charge for Benphysio for KL outlet. Okay, today we will share with you all about the knee condition, knee pain. Okay, and do you have a choice for knee pain and arthritis beside of knee replacement? Can I know how many participants that here have this kind of condition, knee condition? One. Feel uncomfortable. Okay, two. Just started. Just started. I see. All right. So mostly I can believe 95% of population have a knee condition at least once in their life. Huh? At least, yeah. Then later I will discuss with you. I will share with you why everyone will have this kind of condition. All right. Can okay. So here is our founder of Benphysio. So maybe later he will come. All right. So this he built Benphysio almost 10 years already, and he have his own approach, which is all of us will follow. Okay. And then we also will be trained expert as we can. All right. About the approach, a new approach, a different approach of what happened to your body. Okay. How to control your body, why this pain, where is the root cause. Okay. So here it is, Mr. Ben. All right. Next. And then we have okay, so we have 5 branches now. So for where you can find us, first at Damansara, our HQ. Second is Bangsar. Then Puchong, KL Ampang, Bangi soon. We will open in the Bangi soon. All right. All right. Before we start our main topics, okay, I will brief a bit about what is physiotherapy, because now people still confused about what actually is our role. Okay. And then why you need a physio. Okay, so is it because of you when you got pain you come to physio, or when you are good now no pain nothing happened then you come to physio, or how, what condition do you when you need a physiotherapy? And then the third one is physio versus chiro. Fourth one is who is Benphysio, who is us? And then myth and fact about knee pain. Okay, is it true about what people talk, like less gel? Is it true because of less gel? Because most of the case when they get inject, it's still pain. Okay, later I will share with you. And the last one is common knee injuries and what is the best solution. When people say we will exercise, what kind of exercise? Because people when hear about exercise, malas lah, lazy lah. That's one, right? Penat lah, betul. So what is the easy one? What is you can do during like when you masak, when you cook? Okay, what is the best exercise you can practice? Okay, in the same time it will not make you feel like very hard to do exercise. All right, next slide. Okay, anyone here that never went to physio center? All okay, all have experience with physio center, right? Can I pick one person? Have you went to a physio center before? Okay, what is the treatment typically they will give to you? Slip disc. I see. I see. So what is the treatment usually they receive? Extension or section. Okay. 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 Oh, a lot, a lot. Hot pack, cold pack. A balloon also. I see. All right. A lot of things you have received. Okay, I understand. All right. So in Benphysio, what is our practice? We don't use ultrasound. Okay. We don't use TENS machine. We don't ask you to do exercise a lot. Okay. And we don't give you a knee exercise for knee pain. Okay. Because we treat patient by diagnose them, find the root cause, not because of the pain on the knee. We need to focus on your knee. Actually, it's come from the other part. How can be your knee can be compressed? Is it suddenly compressed? Impossible. Okay. And then what is different about us is we listen to your complaint, and then we will assess you, find the root cause, not only assess on your knee, we will also the whole of body. Is it because of your back condition create your knee pain? All right. And then we will diagnose you based on the assessment finding, and we will treat you based on the biomechanic movement. Okay. Next. All right. All right. Okay. So basically, people will like surrender when already have knee pain. Oh, I'm surrender. This knee pain will bring me until to the grave. Okay. Until die, I will give. You have this knee pain. No. All of condition, physical condition that related with a movement, there's a solution. So we are as your mechanic to fix your joint and movement. Okay. Beside our hair, all we can treat. Okay. Okay. All we can treat. Why I said we are like a mechanic. Okay, if you got fever, you go to clinic, you take a medicine, then your fever, your temperature will lower down. If you got inflammation like flu, okay, you take a medicine, then your flu will be getting better. Okay, but you have a movement problem. You cannot bend your elbow. You cannot bend your knee. You take a medicine, you can bend your knee directly. No, so we are your medicine. We are your mechanic. Okay. So a physiotherapy is your mechanic. So if you have any kind of movement problem, any kind of we feel weakness, you feel pain on your body, so we are your medicine. We are your mechanic. All right. So our body is like a machine. There's a lever system, there's a pulley system, there's a ball and socket system, there's a hinge system. So we are mechanic to fix it, make sure your joint, your muscles work well. Okay. Besides of movement condition, movement that related with your physical, we also treat, we will treat, and we are specialized in pregnancy lower back pain. Golf, anyone play golf here? No, all right, that's all right. So for your information, Benphysio KL, there's a one, all of our colleagues here is specialized in golf, especially me. Okay, we are specialized in golf, so we will find out a different of phase of golf that create injury. Okay. Running, marathon, that will be related with B condition also. And this last one is the digestive related, a gastric. You should the root cause from your back. Okay, next slide. All right, this is the common question when they come to physio. They will confuse either like, hey, you physio, did you do a chiro or do crack one? No, we don't do the crack one. We have that kind of treatment. We call it as upthrust or manipulation, but we don't use it unnecessary. Depends on the situation. Not all condition we apply with the chiro technique. We call it as manipulation of upthrust. Okay, what is different between physio and chiro? Number one is physio. We are not a doctor. We are just a health practitioner regulated under private Health Act MOH. Okay, chiropractor also not a doctor. Okay, anyone go to chiro before? One, no, never. All right. So usually chiro will entitle them as a doctor, but the doctor is commonly will be used in when they are at the US or UK. Okay. So but the level is same like physiotherapy, which is degree with honor. Okay. So usually in Malaysia, we will never use a doctor for chiro. All right. And then where can you see us? You can see us in a hospital, government, private, or center, private center, nursing home, gym also sometimes they will provide for the physio, but not for the chiro. Chiro only have in their own center only. Okay. Then we will never find out chiropractor inside the private hospital also. All right. And our approach is parallel with the International Classification of Functional Disability and ICF. But the chiro one, we're not sure what is their approach for now. There is no, there's less of evidence base about their approach. And then the treatment method, we use the soft manipulation, joint manipulation, joint manipulation is like a chiro one. We do like a bit crack. There's a different level of crack. Okay. And then we also do exercise and electrotherapy. Okay. But the chiropractor, they adjust the joints, bones, and spine. That's the typical one we heard it. All right. So, what is soft tissue? When we talk about any kind of injury, we will relate it with soft tissue. Soft tissue include of muscles, tendon, ligament, and then any kind of related with around of your joint and your limb, your body. Okay. What is related with the kampung chicken and city chicken? Okay. True. Okay, very tough. And city chicken? Digestion, betul, I agree. Okay. But usually city chicken will be a bit lazy and because they are just static there. Okay. So the muscle of human also be different like that. Okay. So if you active means your muscle will be tightened or will be like hardened one. Okay. But the difference is when you overuse it or there's a certain of changes of biomechanic, changes of direction of your joint, injury happen. Okay. And then who create which part of your body that create changes of direction? Because of muscle. So the other muscle create another injury to the other muscle. Okay. However, have you heard about this term? I don't do anything, but I got knee pain. This is also the common one. Okay. I don't do running, I don't do squatting, I don't do lunging, but I still got the knee pain. Okay. Means that if you are less move, also you easy to get injury because your joint is not stabilized. There's less of stability on your joint when your muscle, all of your muscle around of your knee is weak. All right. And we go to the next slide. Okay, when do you need a physio? When your body feel number one weak. Okay. If you have heard about when I going upstairs, I feel like very hard to bring up my leg. Very berat one. Okay. So means that your leg is in the weak condition. Number two, when you have cramp, especially at night. Okay. This is because of there is some changes direction of your knee position because of the muscle pulling. Okay. Number two, pain. Of course, pain, meet physio, meet doctor first, right? And then the last one is when you have swollen leg or swollen a specific area, redness and inflammation. Okay. So what do you know about knee pain? Miss May, what do you understand about knee pain actually at first? Why you got knee pain? Uh-huh. 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 Okay. Okay. So overweight, compensating of muscle, create a new joint. All right. Can I ask you, Miss? How about you? Why you just start feel the knee pain? What is your expectation? What happened inside your knee actually? About the knee pain, what you understand when you feel like I'm start to have a knee pain? What happened? And there's some like you do some Google, you ask your friends. So what is your understanding about knee pain? Yeah, you mentioned before like that. Okay. Okay. Wear and tear, yes. Mm-hmm. 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 Like a car lah, need to put some grease. I see. Mm-hmm. 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 Yeah. Okay. Yeah. I see. Thank you. Thank you for your sharing. All right. So please go to. All right. So in Western medicine says there will be a no gel. All right. No gel, less grease. There's a friction. That's why not to. There's less of lubricant around the knee. That's why it keep friction each other. And then at the same time also they will use another word, no cartilage between of your joint. And then there's no joint space. So all is related. No gel, no cartilage, no joint space or compression between your joint. And then impingement between your knee. And no joint space. Your joint, your knee space is reduced. That's why create another friction because of less gel or less cartilage. That's what typically people will get an explanation about it, about the knee pain. Yeah. And then when you heard about less gel, no cartilage, no joint space, automatically we will mention like, oh, I need a gel inside my knee now. Okay. So you need the injection to increase the gel. Okay. And then, so when what you understand, when you gel fill in your knee, then the fluid will increase inside your knee, so it's more lubricant. Okay, that's usually what is typically Western medicine will say, and not Western medicine also. Among of us was already exposed and have that words, which is less gel, put gel, and then better. Normal, right? Then normal what for knee pain. All right, go to the next slide. So when you got the knee pain, Western medicine says that is the early of arthritis symptom. Okay, and then you also have heard about the patella femoral syndrome, which is there's complaint like, oh, I don't know, it's not pain here, but pain inside my knee. Okay, that's the symptom, and also the chondromalacia. Okay, next. Okay, myth number 1: does exercise matter? So there's a two situation. If you do exercise regularly, you got knee pain. If you do not do much exercise, also you got knee pain. How? So what happened actually? All right. Okay. So this is the myth number 1. You have heard it before? You tak gerak pun sakit, you gerak pun sakit. So what happened? Huh? Engine oil tapi kalau if you are less use, how you use the gel? The gel means the gel is not to use. Right? All right. Next, we go one by one. Okay. Second myth: does body weight matters? All right. I am overweight. I got knee pain. However, my friend is quite thin. Still got knee pain. Is it your body weight is cause of the knee pain? Okay. All right. So actually, in my opinion, yeah, body weight is not the root cause of knee pain, but the food intake when you are overweight, okay, like high of glucose, high of sugar, fine sugar, and then high of salt and high of oil. Once you get inflammation inside your knee, it will delay the recovery. This one is fact. Okay, but because of people imagine because of the body weight increase, there's high of gravity pull down, create another compression on your knee. That is myth. Okay. Okay. Yes. Yeah. But actually, maybe doctor explained it in the other way because of the food intake. You will get an obese because of take a lot of sugar, salt, delay the recovery. Yes, but there's also have a overweight patient but got no knee pain. It depends on the food that they take. Yes. Okay. And then next we go to the third myth. Does age matters? Okay. When we talk about age, I remember one patient I received. He come to physio at 70 years old. He come not because of knee condition. He come because of the shoulder condition. He come here because he want to have he will join a marathon competition, standard chartered 42 kilometers. The knee is very healthy, 70 years old. Okay, means that age is not a matter for you. You must, when you reach 50, you must have knee pain. That is myth. Okay, that is myth. Next. Okay. How about this total knee replacement is my only option. Okay. So when you reach at a certain age, doctor will suggest for you to do a total knee replacement. However, they will give an option to do physio first, okay, before they proceed with the surgery, okay. But at the certain age, like 80s or 90s, they will not suggest to do the total knee replacement because they will be worried about the complication happen during the surgery, okay. So the total knee replacement is not the only option. There is a second option, which is as a your mechanic, a physiotherapy. Right. Next slide. And does glucosamine works? Okay. So usually they will say, yeah, after I take a glucosamine, after I got knee pain, it's getting better. After 1 to 2 weeks, it's come back. Okay. Oh, never take. Never take. Okay. Yes, glucosamine is effective, but it's effective on the inflammation part, which is between of your knee joint, which in the inflammation condition. But if there's still have a muscle pulling and the position of your knee is still same, The muscle is keep pulling, the compression is still there. How you want it want to be recovered? Understand? Now medicine already go into the joint to treat the inflammation, but the muscle is keep pulling. How it want to recover? So it means that we need to tackle the muscle first. Okay, later I will explain. I will share with you what muscle we will treat. Next. Okay, so our body, our joint, our body is like there's a hinge joint. Okay, there's like a two block. We need to combine it. Okay, how to combine it? How to support it? Make sure your muscle is less tight. Okay, there is no injury. Okay, there is not about the gel less. The gel less, yes, I understand. You understand about the gel less. But the thing is, when your muscle is keep pulling, can I have the knee model? Knee model. Thank you. Okay, here is our knee model. All right, as you can see here, so this knee model is on a line. Okay, what happens if this muscle is pulling? It create another compression here and the friction inflammation happen. Okay, how about is the other muscle pulling from here? There's muscle here. If it pulling here, when you bend it, okay, it will change the position of your patella. And if there's a lot of compression around your knee, what happened to your knee? There will be a compression between of the joint. Okay, then the inflammation happen. Okay, and it create a less space between the joint. Okay, so that's why I mentioned we are focusing on your muscle that create the joint become less space and inflame. Okay, next slide. So a good physiotherapy must be able to identify, number one, where is the pain? Number two, which movement trigger the pain? Number three, what is the mechanism of pain? How the pain can become? How the pain can be goes? Okay, and then what is the structure involved to induce the pain? All right. Okay, so what just now when I explained about the knee condition, we are not banned or not or disagree with the degeneration or osteoarthritis. We respect the degeneration and arthritis, which is when your age is increased, the inflammation is delayed. Okay, the inflammation recovery is delayed. Okay, that's what I mean by why when you got age and your age is increased, then you got a knee pain, not because of your jealous or because of your age. There's a certain situation or condition when you maintain well your knee, okay, your knee will recover well. Okay, means that your age is not the root cause. But if it happened, it's because of your age increase, the recovery process is less. Okay. However, we can avoid from the complication or make your knee become worse when we tackle the muscle. Okay. And then change on the knee structure may be irreversible, but we believe it is still possible to minimize the pain. At least you can walk. And then when you sleep, there's no pain. When you wake up, there's less stiffness around your knee. Okay, with optimal movement and have a better quality of life. Okay, what are the requirements for the replacement? Okay, when before or after you meet with physio, you have an experience of pain 24 hours. It already disturbed your sleep. You lose appetite because of the pain. Okay, you reduce your weight also, but the pain is still there. Okay, and then there's deformity. As you can see, there's like a hardened swollen on your knee. And then age more than 60, okay, we will recommend for you to do a replacement. Okay, we recommend. But however, usually for the age 60, to do a physiotherapy, it's take a time because you already use your muscle more than 30, 40 years with that kind of condition. Okay. Next. Okay, in the X-ray, you will find the result is like this. Anyone have a knee condition, got the X-ray result? Yeah, like this also, okay? All right, so usually when in X-ray, a 2D image, okay, you will see that between of your joint, knee is reduced, okay? All right, so like here, okay? Like this part and this part. All right, so the space between there is reduced. And if you can see, this is the healthy one. Sorry, this is the laying down when you lay down, and this is when you're standing. Okay, why? Because when you lie down, your muscle is inactive. When you're standing, your muscle is active. Okay, same. Sometimes when when it's too long, inflame inside there, it will make the bone become deformed. Okay, growth of bone. Okay, next. So this is one of the deformity that we just mentioned. As you can see, the angle of your this side is more. Okay, like your knee is like become like this. Okay. Okay. So in Benphysio, we have 17 categories of knee pain. However, when we use this 5 in Malaysia, this is the most case that we receive in Malaysia. Okay, the 5 condition. The first one is quad myth, when you quadricep. Okay, and then go up pain, when you're going upstairs is pain. A runner knees, when you're going down stairs is pain. A popliteus pain, which is there is a sudden onset of pain when you do something like there's nothing you do more or less, but suddenly you feel like uncomfortable. You cannot bend or you cannot straight your knee. Okay, a sudden of severe pain means that the popliteus muscle is pain. The fourth one is extraneous. You will feel like a fever pain, uncomfortable around your stomach, uncomfortable around your inner thighs. Okay. And the last one, if you cannot find, or the last one, if all is negative for all four category, the last one we will find out the root cause by look on your gait pattern, how you walk. Okay, is there any imbalance of muscle? Okay, is there any change of phase of your gait pattern? All right. Okay, let's we discuss. Let I share with you the first one, the quadricep myth. Okay. Okay, I'm going to use this one. Okay, quadricep myth. When you do a squatting, when you do a lunging, when you go upstairs, you will use your quadricep muscle more. What happened if I want to use this? I want to use. Wait a moment, I take something. Okay. So your quadricep muscle attachment at your ilium. This is your ilium. I will put my quadricep muscle on my greater tuberosity of your knee here. This is the attachment I put here. Okay. What happened to the muscle? Okay, what happened? Oh, sorry. Sorry, like this. Okay, what happened to the muscle? If you use more to contract it, it's shortening. It's shortening, it's shortening. Okay. What happened to your patella? Now, this muscle is already attached to your patella or your kneecap. So there's a compression between of your knee, number one. Number two, the front part of your knee here, because of the pulling off from the muscles, will create a compression between your knee at the front part. Okay, that's why when you push to the front, you feel uncomfortable at the front or inside your knee. Okay, so that's what happened. When you're going upstairs, means that your quadricep muscle is tight. Okay. 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 So first you will feel pain at the front, okay, or inside the cap, or below the cap, here or here. Okay. And then when you bend and you straight it, there will be a cracking sound because of friction between your kneecap and the knee joint. Okay. And then also you feel weak. Remember, besides of pain, if you feel hard to lift up your leg or to push up your leg when you're going upstairs, means that your quadricep muscle is tight. Okay. Okay. This, why it's tight? Why it's tight? Because of there is a scarring of retinaculum here. Okay. So while the muscle is keep pulling, the scar and the inflammation still keep happen at the retinaculum. So wear and tear happen. Okay. All right. So inside here, what I want to mention is we are more focusing. We are target on the specific part of the root cause of the muscle that related with the knee condition. It depends on what movement you did and create the pain. Okay. Number one is quadricep muscle. Okay. So okay. This is the movement that typically will make your knee become pain. Okay. People will say knee pain, mini pain, but do not know where is it. So the first one is quadricep. When you do going upstairs, squatting, climbing uphill, and then stand up. Okay, when you stand up, also pain. Okay, and then when you do half squatting or when you want, okay, we don't say about half squatting. When you want to pick up something, bend your knee, then you feel pain. Also because of the quadricep tightness. Okay, how to make it much better? By do a simple stretching. If you at the kitchen also you can do. Okay, I borrow this chair. Sorry. Okay, if you at kitchen, when after you wash your pinggan and everything, you can just stand up for one leg and then stretch it. Make sure don't bend your body. Straight your body. You cannot see your knee. Okay, you cannot see straight your body and do some stretching for your quadricep muscle to be stretched. Okay, if you are rajin sikit, you can do like this lah. Okay, just put your yoga mat and then do like stretching, stretch your quadricep muscle, just bend your knee. Okay. All right, next. There's a lot of stretching. There is a stretching technique for the quadricep. Right, next. Okay, this is the roller form. Here, you can roll it on your quadricep muscle directly. Okay, it is also effective. Okay, but if the muscle is too tight, too deep, then you need to meet with us to release the muscle pulling. Okay. Myth about quad stretching. Okay, how about if you feel like after you do a stretching, why I still got the knee pain? Why I still got knee pain? I already do the stretching for the quadricep. I still feel the knee pain. Okay, and then beside of stretch the muscle, okay, there is one thing that when you walk, when you do any movement, okay, human will miss this part, which is your gluteal muscle. Okay, when you walk, you need to use the biggest muscle, which is your gluteal muscle, engagement of your gluteal muscle. Okay. At the end of the session, I think your gluteal muscle. At the end of the session, I will show to you how to create or how to engage your glute muscle when you walk, when you do anything, when you stand up, how to engage it. Okay. Besides of the quadricep stretching, there's another muscle that we need to engage. All of knee condition, you can use the same technique. At the end of the session, I will share with you. Next. For the ITB or runner's knee, what movement cause a pain? When you're going downstairs, when you are running, when anything that move down, okay? Usually you will, when you're going downstairs, when you feel uncomfortable, you will go one by one of the stairs, okay? Yes, okay. So different, right? Why, if you got the knee pain, why going up not pain, but going down is pain? Because not really accurate actually, because of the muscle is start active and it will change the position. Yeah. Okay, understand. Okay, I understand. So that I explain what happened actually. Why going downstairs is pain? Because people will think about the sliding of your knee, put more force to the front, right? Okay, later I will explain to you why. So the movement that we are related with the ITB or runner's knee is these three main movement, anything that going down. Okay, next. Sorry, back. Okay, which leg? Okay, which leg? Usually, if you got the ITB tightness, ITB muscle tightness, it will happen on your non-dominant side. Okay, If your dominant right dominant hand, okay, right dominant leg, your quadricep will work more. Okay, so if you got the quadricep tightness, you got pain on the at the front part, it's more on your right side. However, for the left side, it's more to your ITB. Why? People will keep mention like, I use my right more. I use my right more. Actually, your left side is used more. Why? Okay, I give you an example. If I play a badminton, yes, I will push down, up, down. I will use my right to move front right. But the thing is you see on my left, always stabilize this side. See? So who will work more? This one, when I press, it work. When I release, it rests. And I press, it work. When I release, it press. But what happened on left side? Okay. So when you stand, do one leg stand, and if you got a knee pain, means that your ITB is tight also. Okay. So means your ITB tightness will mostly happen on your left side. Your stabilized muscle. Okay, when you want to stand up, sometimes you feel uncomfortable, you will like this. This is stabilized muscle. It's naturally, you tak perasan, but you will stand like this. Okay, so that's what happened. All right, and then okay, next. Okay, so explanation mechanism of ITB runner. Why you got a knee pain? Because of from the ITB tightness, how it happened. Two reasons. Number one, because of your ITB muscle. Okay, ITB muscle is from the attachment is from your pelvic here, okay, until your tibia here, down here area, okay. And at the same time, glute med is the position of glute medius is at the same place of your ITB muscle. Your ITB muscle at the side of your hip, okay. Two reasons, because number one, because of stiffness of your ITB. Remember I said weak also make your knee pain. So your ITB also weak or glute med is weak will create knee pain also, okay. Because of why? Because of increase of hip internal rotation, okay, and increase of knee adduction. So there's a force that go to here, this part of your knee, okay. The direction, the changes of your biomechanic, the changes of your knee direction, okay. Muscle apa? Oh, tepi. Okay, so this is the muscle that I mentioned. Your ITB muscle is from here, okay, to here, and your glute medius also will be here. So to those that have a pain on your left side because of ITB tightness, you will feel uncomfortable around your lower back, also like around your hip, your hip and pelvic area. Okay. Next. Next. All right, there it is. Okay, so typically you will see that in your X-ray in 2D image, this is right side. Okay, so your knee space, okay, will go like this. Okay, there's less space on the outside part of your knee. Okay, next. Okay, so everyone, when you're going back today, make sure you check either there's a ITB groove, self check if there's any ITB groove or not. Is okay. ITB groove is okay. Can one person stand up? Okay. So can I make your knee as a model? Can you? No problem, eh? Can. So okay, can you? Okay. So here is the groove. Here is the groove. If you can see the groove is more deeper, means that your ITB is more tightened. Okay, just keep pulling until you can see like until you can glide the tendon already, means that your ITB is very tight one. Okay. Okay, thank you so much. Explanation about ITB. Okay. Okay, this one. So ITB muscle in this model is at the side. Okay. So the attachment was at here. Okay. What happened when it's pulling up? It's pulling up like this. So there's a lot of tendon here. We call this as a retinaculum. Okay. So when this one is pulling up, what happened to your kneecap? It will change the position of kneecap. Number one, it will change your position of your knee. That's why in 2D image, you will see the space is reduced. Actually, not it's because of the space is reduced, because there's a changes of direction of your knee. Okay, if your knee direction is good, means that normal, the space is normal. But if there's a changes, of course, it's not in a line. Okay, so you will see in the 2D image, there is a changes of your direction, less space at the end of, at the tip of your knee. Okay, so when you move your knee, when the direction is changes, friction happen, inflammation happen. Okay, so typically you will feel pain if you got the ITB tightness, knee pain because of ITB tightness. The pain that you will feel is at inner side and outside of your kneecap. Okay, we differentiate. The quadricep is at the front or inside the kneecap. The ITB tightness, pain at the outside and inside of your knee. So there is different. Okay, different movement, different symptom. Okay, different kind of pain around the knee. So that's what happened. The ITB pulling change your position of your kneecap and change your position of your knee. When you move, there will be a cracking sound, and when you move, there will be friction each other. In the 2D image, it will show the less space because there's a change of direction of your knee. Okay. Okay. It's shown here. So this is the pain area inside, outside, cracking sound. Same also. If there's no pain on your knee, but you feel weak when you want to going downstairs. Okay, that also the same nature of movement. Okay, will give a same muscle problem, ITB tightness. When you're going downstairs, you feel weak, means that your ITB muscle is tight. Same explanation also. This is due to scarring and retinaculum after wear and tear. Okay. Okay, besides of knee pain, okay, if you feel pain around your hip area, okay, direct to the ITB part, okay, this is the area that you feel uncomfortable, you feel pain, you feel like very like pulling, stiff and weak, you cannot lift up your leg, okay. So this is the pain area which is at the top hip here, okay. When you sit, when you're going downstairs, you feel like something pulling, hold your hip. Okay, means that same also, there's an ITB symptom. And then for the younger, there will be a cracking sound a bit around your hip. You feel like, I don't know what this is. There's no pain, but there's a cracking sound when I move it. Okay, means that your ITB is tight. Okay, Surish Surish sound is like one. Okay, for the elderly. Okay. And then when you feel weak to put weight, you cannot stand like this. Okay, if you got the ITB tightness, okay, your ITB muscle tightness, you cannot do one leg stand. Okay, you feel like, oh, cannot lah. Oh, cannot lah. Okay. Okay, explanation why? Because there's a nerve irritation. This is next episode of the knee pain due to ITB tightness. When your ITB is not treated well, you will get the nerve irritation because your main muscle, your main nerve, this is the area that the flow of your nerve, okay, at the ITB, and then because of the nerve irritation, the next episode of your knee, if your knee is not treated, and then you feel the pain around your hip, okay, this is the next episode of knee pain. There will be a nerve irritation happen around your hip, okay. So be careful before it go to this episode. Make sure you meet with doctor or physio first. All right. Next. Okay. Self-help, ITB and glute med stretching. So here is the exercise. Pigeon movement. There will be a cross leg stretching. Next. In lying down position also. Okay, can you go to previous one? All right, this one when you wake up in the morning, okay, you can practice on your bed, okay, just do a simple stretching, okay, some mobilizing around your hip and knee, Okay. Usually, if you got a knee pain, they will ask you to stretch, to do a lot of movement around your knee. No, actually, you just need to tackle a specific part of muscles like this. So not too many exercise you need to do, right? Maybe just one like that one, boleh kan? So just one movement is more to specific part. You not cover that everything. You need to do this, there, a lot of exercise. Just a specific area. Okay, so it's more focusing. Next. In lying down position also. Okay, before you sleep, you can practice this position, this movement on your bed also. This is for ITB, that one's for more to glute med. Next. Another self-help for ITB and glute med stretching. All right. Okay, sorry, back. So this is the position and how to use the roller form on your glute med and ITB. So as you can see, it is direct to the muscle that I showed just now on your side of your hip and on your side of your pelvic area. Okay. Beside of roller form also, you can use the tennis ball also. But tennis ball is too small on your ITB. Roller form is much suitable. But the tennis ball you can use on your glute med, this area. And now I believe now if you press also feel uncomfortable. Yeah, very uncomfortable one. Yeah, here. Okay. Next. Okay. The third one, the popliteus. This is our any branch. This is the favorite condition, popliteal muscle, which is the condition your knee cannot be bent and cannot be straight. All right. So the popliteal is very like a ghost muscle because it at the back of your knee. Okay. Usually people are scared to press on there because people said there's a big blood vessel there, right? And did you hear about it? People are scared to press at the back of your knee because there's ada darah besar belakang ni. Very dangerous to press. No, you need to find someone that expert which part of the popliteus muscle that can be pressed. Okay, next. Okay, so severe knee pain, we call it as a popliteus cramp. Okay, so what you are unable to do, number one, you are unable to weight bearing. Easy to say that you cannot, if you walk, you will walk like this. You feel very heavy on your pain part, but actually it's because of your knee, not because of your back. Okay, so number one, you're unable to weight bearing, you feel very uncomfortable, okay, pain, and then feel weak also, and then sudden onset. Okay, there's nothing you do much, more or less, but suddenly you got uncomfortable on the right side, suddenly of pain. Your popliteus muscle is cramping. And the third one, you unable to bend and straight your knee. Okay, you cannot bend, you cannot straight. You will like this. When you walk, there will be a limping gait. Okay, next. So what are the factors? Okay, there is sharp pain around your joint line. Okay, at the side here, there's a joint line. Okay, you feel uncomfortable at your joint line, and then you will feel cold around your feet. Okay, because of poor blood circulation on your lower body. Okay, once your popliteus cramp, yeah, your blood at the back of your hair, when the muscle is cramping, okay, it will disturb your blood circulation also. You feel cold on your feet. And then I believe this one is very a lot of myth about varicose veins. Okay, certain people say that because of lepas beranak, varicose vein banyak, putus urat kan. Okay, actually once you got when you have a varicose vein condition, mostly of the case we find out you have a popliteal cramp. Okay, okay. You will have a popliteal cramp. Means that your back of your muscle at the back of your knee is have cramp before and it cramp, but it didn't give any symptom yet because there is no wear and tear yet. But it will trigger with another condition. We call it as a varicose vein. Varicose vein ni macam is to spider web, urat-urat banyak kat kaki. And as you can see, that vein also is grow more to your cuff area. Why not at the front? Why cuff area? Okay. So there's a question, later I will answer it. Next. So besides, okay, there's a lot condition there's a lot of factor that you can see for the popliteus condition. The seventh one, when you have hyperextended knee, which is you in a lordotic posture. Lordotic posture is high bum. Okay, you have a high bum. Okay, the curve of your lower back is increased. We create the hyperextended of knee. Your knee is become too hyper like this. Okay, too hyper like this. This also because of your popliteus cramping. Okay, and the last one is swelling above the knee. Okay, selalu very common. You can see swollen. If it not happen under your knee, it will happen outside of your knee. Means that your popliteus has been injured. Okay. Next. Okay, here. This is one of the popliteus condition. One of our testimony of before and after the treatment. He look like, usually they will say like, I can bend my knee. Okay, you see, but there's a compensating of movement. They move forward. Okay, still we count it as a popliteus case. Okay, and after the treatment, there's no more compensating of muscle. Okay, there's no more compensating of movement also. Next. Okay, self-check behind the leg. How you want to self-check? So take a mirror lah. Take a mirror, look at the mirror at your home. Self-check. Is there any changes of size of cuff or size of your popliteus area? We call this as a popliteus area. Is the shape is too pop out? Okay, or just same left and right? And then number two is any visible of veins. Okay, you see, usually veins will be formed around here. Plus the varicose vein, as you can see, either one side only, more. Both have, but typically it will show more on the left or right, or either one side is more. Okay, so any visible of veins around of your popliteus area. If you have some different for these two things, means positive. I have a popliteal cramp. Okay. Next. Okay. Okay. Let me explain to you what happened to the popliteus. Okay, popliteus. Wait, this is right side. Popliteus attachment is at here and here. What happened when it cramp? Okay, when this muscle is attached here, what happens? Same also there, it will change the direction of your knee. More worse than ITB. Okay, once the popliteus cramp, it will make more worse on your knee condition. When it cramp, it will change the direction of your knee, number one. That's why you feel pain around your line joint. Okay, because the attachment is at here. Okay, your knee part and your femur part. Okay, your knee part below the knee part and upper knee part at the back. So the position is like this, cross. Okay, so when in this position, you cannot bend, you cannot straight because this one is cramping. Okay, so that's what happened. This is popliteus muscle attachment. Okay, and then so this is the self-help or stretching technique for the pop and cuff. All right, you can put your feet on the wall. Same goes with your hand, and then bend forward and not bend forward, move forward. Okay, and stretch your cuff. All right. Next. Okay, you can use also tools like a towel to stretch your calf. All right, next. Okay, on the stairs, you can do like this. You can put your feet at the end tip of the stairs and put down, okay, your heel down and then bring up. Okay, this is one of the stretching for the calf and popliteus. Next. You can use the roller form also on your calf. Okay, roll your calf by using the roller form until at the end of your knee joint, knee line. Next. Okay, pes and serenius. By the way, before I go to the pes serenius, is there any question about the three main muscle that related with the knee condition? Okay. Okay. I will answer that question after this part. I see. Okay, sure. Okay. All right. So I can continue, yeah? All right. So anatomy of pes serenius. Okay, pes serenius is at the middle part of your knee. There's a three muscle attached on the pes serenius. Okay, next. Okay, there it is. So three muscle that related is your semitendinosus, your hamstring muscle inside of hamstring muscle. Okay, your gracilis tendon and your sartorius tendon. This is two spines, right? Two anatomy, right? But you just need to know there's three muscle that attach on this pes and serenius. Okay, so once you feel tight or you feel swollen around that area, means that your three of this muscle will be pulling, and you will feel uncomfortable around your inner thigh. Okay, certain case if you feel like your inner thigh is quite pulling, okay, it's not because of your muscle, because there is inflammation inside of the pes serenius. Next. Oh, back. Okay, most of the case that we find out for the pes condition, they will feel uncomfortable around the hip. Certain case, they will feel uncomfortable around the hip. So when we do an assessment and check, so there's a pulling at the inner thigh. Okay, so we find out there is a swollen around the knee. So the symptom is not close to the knee, but it's when it's pulling, it will give a symptom to your hip. You will feel uncomfortable around your inner thigh here. Okay, your inner thigh is very pulling one, and there's one point at your groin also you pain. Okay. Next. All right, for the gait analysis. So when we assess you all, we assess our patient, when this four of this muscle is negative, then we need to check back you feel uncomfortable but do not know where, okay, and when. Sometimes have, sometimes don't have. So we check your gait pattern, your walking pattern, how you walk, is there any changes of stance phase or swing phase, okay, when in the swing phase, okay, when your leg is still on the air, and when you touch the ground, is there any changes on your ankle, on your knee, on your hip, and is there any changes or switching of your pelvic movement? Okay. Next. For athlete, usually we will not use the gait analysis. We use the running gait analysis, because usually pain will trigger when they are running. Okay, the pain trigger when they are running. So we need to know the symptom or need find the root cause by follow the what activity that they will use. Next. Okay. Previous. Oh, okay. So that is the main four muscle that related with the knee pain. Okay. So let me answer your question. Gel, yes, gel will be effective, but will be come back. Means that gel is not treat the root cause. Okay, if you put the gel inside your knee, yes, it will release, but another month you feel same also. The knee pain will come back. Okay, the knee pain will be come back because the root cause is not from the gel itself. It's coming from the muscle that keep pulling and create a compression between your knee and change all the direction of your knee. That's why that's the root cause of your knee pain, not because of the gel is reduced. If we said the gel is reduced, who reduce it? Who make the gel reduce? So the muscle is keep pulling, create the change or direction of your knee, create a compression, then the gel will reduce. Okay. So if you put gel but you not treat your muscle, same thing will come happen. The symptom will come back for sure, 100%. All right. Not beside of physio, stretching, exercise, there's a specific muscle that create of your knee condition. Okay, because as you can see, there's a lot of myth. It's because of gel and everything. Okay, and mostly of our patients do not know what happened to the knee. Sometimes there's a complaint pain at the front of your knee. Certain complaint at the side of your knee. So what happened actually? So different of movement, okay, will trigger different of pain, and we relate with different of muscles. So that's the way how we will find out what happened to your knee. Okay, and certain case, if the muscle, if the knee condition is more than 3 years or 5 years, it will related with your lower back. The next or the scenario, typical scenario, if you got the knee pain more than 5 years, it will trigger your lower back pain also, because there's a lot of compensating muscle happen. Okay, like I said, you already changed your direction of your knee, change the direction of your knee. Okay, and if you got pain, if you got limping, our body is naturalized, natural to be adapt with the comfortable condition. Like if you feel knee pain, you will limping. Okay, your heel will feel off. But who will walk like this for 1 year? Never, right? So our body will naturally change the position of your knee, become like your feet become like this. Okay, that's why you can see that a lot of people will walk like this, because they want to make their knee comfortable. But what happened then when they compensate the movement? It will pull the lower back, because once you change the direction of your knee, your see my pelvic will going up. It will going up like this. Okay, so there will be a pulling on your lower back. The next episode of knee pain, it will trigger your slip disc because of your lower back already pulling. Okay, so better to avoid the knee pain become getting worse and compensate to other area, other part. People will say like, "Ay, ni sakit pindah lah from here to here, from here to here, from here to here." It's not about the pain is transfer. No, it's about the way you when you hold the knee condition too long, it will compensate the movement and create another condition. Okay. Hmm. Mm-hmm. 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 You're gonna squat, then your quadriceps. You can bend your knee, fully bend. Oh. Mm-hmm. Okay. So means that your quadricep muscle is tight. Your quadricep muscle is tight. Yeah. And you cannot lift up because of pain or weak. Either two of these and weak. You feel berat. Hmm. Uh-huh. Okay. Mm-hmm. Mm-hmm. Uh-huh. I see. Yeah. I suspected, okay, from the subjectively, okay, suspected as a quadricep tightness, okay, because it's related with a direct quadricep movement. If you're going upstairs many times, you feel the pain, okay. Uh-huh. Step down also a problem. So okay, okay. So squatting cannot, going down cannot. Okay, so you already have a quadricep and ITB symptom, and then bend can, right? So popliteus is clear. Probably should be clear, and then yeah, two area of this. Okay, so if you can do first stretching your quadricep and ITB, will release your knee condition. But if the scar is too deep, how many years already? Mm-hmm. 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 That's, mm-hmm. Mm-hmm. I see. Okay. So okay. So you never do the manual therapy or do like okay. Forgot to mention about this. Okay, Benphysio approach is manual therapy. We are specialized in manual therapy. Besides of we find the root cause of the problem, so we will use more of our hands. Our hands is our weapon. It's our spanner and screwdriver. So our practice is manual therapy. This which machine? Oh, there's one machine I never used yet. We open already 8 months, but I never used yet. So all my patients recover by using our hand. So that's our specialized. Exercise also. Yes, we treat your knee with our hand. You can call it as a massage, but when you apply it, then you know, oh, this is not massage. Okay, it's simple word, it's a massage. But when you have an experience with us, then you will see that this is not a massage, different way. Yeah, but it's effective. Okay. All right. So before I proceed with the next slide, any other question about the knee? Yes, that's what happened. Like I mentioned before, if your quadricep or ITB is tight, okay, number one, because of the friction, the alignment of your kneecap or your knee joint is not in the position. So when you glide it, for sure it will, because like this, I show you here. The kneecap is on the line. So there's a hollow here, okay? So if you bend it, it's on the line, okay? But if your kneecap is changes, of course it will prick. There's a friction on the uneven area. That's why there's a cracking. Because of muscle pulling. The 4 muscle that I mentioned just now is keep pulling and change the position of your kneecap and change the position of your knee joint. Yeah, that's why when it moves, it's not in a line, it create another cracking sound. Align back, like I said before, we are specialized in manual therapy. We will align the kneecap by not treated the kneecap. We will treat your muscle that create changes and of the position of your knee, joint, and kneecap. So the 4 muscle that I mentioned just now is the common case that we will solve and settle down the knee condition by tackle these 4 muscle by using our hand. Okay. Yes. For now, in my after I joined Benphysio, and Ben bring a good approach, okay, and specific treatment, okay, I can say that 95% of our case is solved for the knee condition. It is like 95% is the common case we receive, and 95% we settle down the case. Another 5% is not because of the problem is not solved. No, they can at least can walk, but at a certain time they need to rest first. That's all. Not become not getting better, but not 100% recover yet because of the age is more than 60 or 80. That's normal lah. Okay. Hmm. Different of what? The length. Oh, okay. Okay. So this is popular question. You will feel, oh, there's a certain health practitioner that we find out that your leg is shortened and long one. Okay. It is not about your bone is become shortened. It is because of this one is usually we relate with the condition of lower back. Okay. When your muscle of go quite scientific, when your QL muscle, quadratus lumborum muscle is pulling, what happened to your leg? Okay. When you rest, it's still short because of the muscle is keep pulling. So that's what happened. Okay, not because of your bone become shortening. No, never happened. Okay. All right. Am I going to answer question? All right. Farid, is there any question from the online? No. Okay. All right. Online, do you have any question for me? Okay, satu. Okay, what is it? Again? Oh, during running, pain at hip. Spine area. Okay. Usually, if you are running field pain around your back area, okay, we need to check first. Either the pain is coming from direct from your lower back or it's come from your knee first. Okay, we need to check back your gait pattern. Okay, but mostly of the case, we will relate it with knee condition first, and then the compensating muscle keep happen and create your lower back pain. We need to check first. But mostly of the case is coming from your knee first and then going to your lower back. Okay. Anything else? No. Okay. All right. So can we go to the next slide? Next slide maybe. Next slide. Okay. So before back. Okay. This is like a advertisement. All right. So we also in our Damansara, they are just launched a weight loss program. If you want to join, they have a physio that are expert in weight loss program. Before this, they my staff, my colleague is experienced in training program at Celebrity Fitness, Anytime Fitness. Okay. Next. And also they will start and then what is the difference between our training and then another training, another area or center training is they will train you based on your condition. Okay, usually physical trainer will train you like if heavy lah. Okay, there's less protocol, but we are more focusing on your condition. If you got knee pain, so what kind of exercise you can do in the same time you will lose weight. Okay. And also we are just launched a infrared, okay, sauna infrared. Yeah. Okay, nowadays we will use infrared. Before this we will use the charcoal or stone one, but this one is more effective. It not target on your superficial of skin. It will more target on your deep muscle part. Usually in our Damansara, we have launched it at the Damansara and Puchong. We'll treat more to cancer patient. Yes. But if you don't have cancer or don't have any condition, but if you want to relax your muscle, you still can use it. Not too specific to a specific condition. Next. Back. Yeah, here. I will break the wall and then create another room. We will consider to have it actually because it's quite effective. At first, we want to try first at the Damansara, but then it's quite people demand. Our patient is demand to have this off treatment. Then we launch another unit to the Puchong. Okay. All right. So for now, to those that join our class today, our sharing session today, we have happy hour promo. Okay. Package usually our package is 10 plus 1, but now 10 plus 2, but with the same price. Okay, and there's a term condition also. The promo is valid for 2 days only, today and tomorrow. Okay, and at 11:59. Okay. And then next. All right. Thank you. Before I thank you, any other question more from the online before I finish it? Tak ada. All right. Okay. Thank you so much